Hello friends, my name is Dr. Subodh and this is my YouTube channel, Learn from Psychiatrist. In my previous video, I talked about depression, its symptoms and how it can be managed. And antidepressants are one of the options to treat symptoms of depression. So today, we are going to talk about antidepressants. So, what are antidepressants? As the name suggests, antidepressants. That means they're a type of medications which help us to fight the symptoms of depression. But it's just not only the depression which responds to antidepressant therapy. There might be some other mental health issues, for example, anxiety disorders, OCD, and some type of personality disorders which are indication of antidepressant therapy. There can be different type of antidepressant. The older generation were used to call tricyclic antidepressants. For example, amitriptyline, nortriptyline. However, they are not used very frequently in today's practice because they were lethal in overdose and they had some side effects on our heart. That's why they have been used in very specific situations lately. After TCAs came SSRIs or selective serotonin reuptake inhibitors medication. For example, fluoxetine, paroxetine, sertraline, escitalopram, and citalopram. These medications were having very less side effects, they were well tolerated, and they are not lethal in overdose. That's why they are used more frequently. Lately, there has been some of the medication added to artillery, for example, mirtazapine, venlafaxine, and duloxetine. So a common question is that, how do they work? How antidepressants help us to fight the symptoms of depression? Well, if you have watched my previous video about depression, I told you there's a chemical in our brain called serotonin. This serotonin is implicated in symptoms of depression. So there's a common logic that these medications are going to elevate the concentration of serotonin in our brain. And that's how they're gonna fight depression. Now, it's just not only serotonin, there are some other chemicals also, including noradrenaline and dopamine. So some antidepressants also target noradrenaline or dopamine, but you don't need to remember every bit of information. How much time do they take to show some benefits? Well, it's a good question. Unlike painkillers or antipyretics, which usually act very quickly, maybe within hours, antidepressant takes days, maybe weeks to act. So, to say that they are going to have some benefits, the minimum duration of trial is 2 weeks. This duration may be more, probably 4 weeks in older patients, probably due to their slower metabolism. So, to say that, before saying that the antidepressant therapy is ineffective, we should try them for at least 4 to 6 weeks. What are the side effects? Well, it's an important query. A lot of patients, they do ask what are the possible side effects. And I think it should be discussed with every patient because if they are going to take medication, their body is prone to get some side effects. As they act on serotonin, serotonin is just not found in our brain, it's also found in our tummy and blood cells. Therefore, side effect might include a little bit of tummy upset, probably reduced appetite, maybe feeling of sickness, for example, nausea, vomiting, some loose stools. So these are frequent symptoms. Sometimes they can actually worsen your sleep, or maybe they can worsen your anxiety initially because they are activating agents. One of the important side effects is that sometimes they can increase the suicidal ideation in depressive patients. Now, don't be alarmed. We actually monitor our patient for that. And this is usually seen in young or adolescent patients or people who are already having suicidal thoughts. The data suggests that they are actually protective in suicide. So in older people or adults, they are actually protective in terms of suicide. Sometimes they can actually affect our metabolism. So if you are taking antidepressant therapy for a significant amount of time, you can actually put on some weight. And that's why this is something we actually monitor while we are starting someone on antidepressants. Are they effective? Well, obviously, there has been a significant amount of research in depression and antidepressant therapy, and the data suggests that 6 out of 10 patients are going to respond to antidepressant therapy, and that's a really good number. So we can conclusively say that antidepressants are effective in alleviating symptoms of depression. Are they addictive? This is also one of the commonest queries of patients who are starting on antidepressants. Now, if somebody is taking a chemical for a certain period of time, the body is liable to get dependent upon that. But antidepressants, they are not addictive at all. But once you're going to stop antidepressants, probably your body is going to go through some withdrawal effects. Therefore, we suggest our patients to withdraw this medication over a period of a couple of weeks at least. How long do we need to take them? Well, once the symptoms of mental health problem, including depression or anxiety disorders, have completely subsided, I think you need to take medication for at least 6 months. If we are talking about anxiety disorder, including generalized anxiety, the period might be 1 year. So once your symptoms have completely subsided, you need to take medication for at least 6 to 12 months. Some people, they have frequent or recurrent episodes of depression. In such cases, we recommend at least 2 years of continuous antidepressant therapy. What are the alternatives? Well, there can be some alternatives to antidepressant therapy. And if somebody is having mild to moderate antidepressant, the first line treatment should be a talking therapy or psychotherapy rather than taking antidepressants. If somebody is having imminent risk to his life, maybe probably he's not eating or he cannot take medication or he's currently suicidal, I think ECT is one of the options and is very effective in treating that particular kind of depression. One more thing, a lot of patients, they do talk about St. John's wort. It is one of the herbal medication which is widely available to public for the symptoms of depression. But is it effective? Yes, in some cases it do help treating symptoms of depression, but we usually don't prescribe St. John's wort. Why? Because it has got a lot of active ingredients and they can affect our liver and they can affect how our metabolism is working. So they frequently lead to various drug interaction when they are taken or when they are stopped. And sometimes these interactions can be lethal. So my advice would be not to take St. John's wort, go to your therapist or psychiatrist and have a discussion about what kind of therapy or what kind of medication is going to suit you. Now, it's a lot of information to take on board. So I will suggest you, if you have any query, do comment on my video. So I will try to help or I will answer your queries so that you can understand the topic. There's a lot of information available over internet. My suggestion would be to go to BNF or British National Formulary to read more about particular antidepressants. In this video, I cannot include every possible information, so I have talked about the major or common thing you need to know. There are other lot of resources we can actually utilize. So this is all for today. Today we have talked about antidepressants, which are usually used for depression, anxiety disorder, or some personality disorders. They act on a chemical called serotonin. They can have some side effects, but usually they are well tolerated and the side effects are limited. We usually monitor our patients for development of any side effects. They are effective, they are not addictive, and there are some alternative. And if depression is mild to moderate, I think the first line of treatment should be a talking therapy. So I'll see you in my next video. Till then, take care. Bye-bye.